I'm going to bring her to probably to about right there because I want to be able to get into her forearm over here. Is it too much pressure right there? No. And I'm going to totally cover up this third eye right here, whatever's going on. I don't know, it's an eye in the clouds. But that's pretty much the money spot, like just about right there, maybe just at the top of the eyelid. Right in there. And then I'm checking her ibrometer just because I want to see is this causing any problem? Is it like too much pressure? Because if it's too sharp with this, what I'm about to do is probably going to be a little more intense. So all that feels good. And then when is it like when you're doing esthetician work that it causes like pain or discomfort?
Both massage and facials.
Yeah. But you do a mix of both, which is good because you change it up. What was this you just said?
Waxing.
Waxing. Oh, okay. I have no experience of that.
Yeah. Sorry.
Well, I'm not getting a lot of stuff waxed. That's me. Yep. What I'm going to do is come in, and remember we talked about like that arterial tourniquet and sort of like crimping. This is an even smaller structure than the legs. So one, I want to do this as easy as possible. I don't think this version is in the workbook, but this is an elbow on steroids. This is a forearm on steroids, and this is a hand on steroids. Because we've opened up the possibilities of you using your lower body. I want to use my forearm on steroids. It's not bone. It's really this soft outer side of tibialis anterior. This is much more fleshy and soft and forgiving. So what I'm going to do is come in. I'm trying to find an angle here, and I'm judging by her ibrometer there. Do you think a little more towards the elbow or just a little bit more towards the wrist?
Towards the elbow.
A little bit more towards the elbow? What do you think about right there? Okay. Then that's not too much pressure? Because this is just my forearm on steroids coming in, and then I'm going to reinforce using my forearm. And this is stacking my body weight right over that. How's that right there? Okay, so this will be a little more difficult for you guys to see, but you'll probably want to come over to this side at some point. For now, I'm just going to lightly start like mobilizing. Remember we talked about pronator teres? I'm grabbing her thenar eminence, but I'm kind of rolling that open. And then she doesn't have a huge amount of tension in like her thenar eminence around her thumb. I'm just kind of adding that in. But this is the primary thing. Is that too much pressure? When I hang out right there, do you want more shear towards the elbow? More towards the wrist? Now when I shear towards the wrist, what do you think about right there? That's good? There we go. And then, let's see, a little bit there. Just a little bit. How's that? Not too much? Okay. And then for you, what happens if you like close your hand into a fist? And you pull your fist up towards my leg, towards your elbow. There you go. Then you give me the finger. Sure, why not? It's normally it's a joke. You got to throw it into your pain management skills. You're like peace sign. That's cool, whatever. So what happens if you open your hand like out and back, like back and down? There you go. So is that too much? What if I give you some assist right there? There we go. To her edge at least. So you guys come around. It'll block this camera just for a second, but I want you to see this. Like, look at the color on her hand.
You don't have any, by the way.
It's like jaundiced, right? And then you get any tingle or numb in your?
Yeah.
What do you feel? This finger? That's because you didn't give me the middle finger. You didn't distribute that energy through there. You were doing all this. No, I got to do the peace symbol. It's just half a peace symbol. It's just half a peace symbol. What happens if you like close into a fist like repeatedly right here?
Tingle through all the fingers.
Tingles. Do you feel it through your wrist at all?
No.
Not through the wrist, but through the fingers.
Actually, yeah, like right kind of.
When you open it up?
Yeah, through like.
There you go. Now, if she wanted to, if she was having a more severe issue, I could have her, I say it's yoga. She's like, oh, right. Oh, right there. If that feels good to her, that's great. I can also just passively, move her around. And then the tingle or like numb, her fingers are getting cold. How you doing there? Does it feel like it's too much pressure over here? Big and broad, right? It don't feel like a forearm, right?
No.
So, tingles, numb, both?
Yeah.
A little bit. And then to release pressure, I'm just going to slowly take the arm off first. but without blocking the camera. If you guys stay where you are, I just want you to watch her hand and like what happens, because my fingers are a little more pink, but the pressure is still on, and I'm going to slowly lean back and back off, and we're going to see what happens to her hand. It also left a nice imprint on top of her tattoo. You can see the pattern from my pants. How does that feel now? Feel more open?